Great, thank you. And then I'll introduce our next speaker is Dr. Angel Xiao, and she's going to be speaking about lower extremity injury rates on turf versus natural grass surfaces and analysis of professional football athletes.
Hi, I'm Angel. I'm one of the R2s, and I obviously have no disclosures. So background, artificial turf has been used in the NFL since about 1966. The big driver of this decision was their multi-use capabilities and then the ease of upkeep, specifically with different weather conditions. Over time, the turf field constructs have been a little different, but they've pretty much been standardized in the NFL so that by 2005, all NFL stadiums had either natural grass or this modern infield surface known as field turf. Recently, there's been a lot of concern about the different biomechanics of this field turf compared to natural grass. There have been some studies that have shown that cleats on synthetic turf have different release mechanics and load absorption. And the concern is these release mechanics lead to more loading stress across the knee and ankle. Whereas in these studies, grass has been shown to release the cleat prior to reaching these injury loads, which overall decreases shear force and torque on the foot. Clinically, though, there's been a lot of conflicting data. So there have been studies that show that synthetic turf is associated with higher rates of ACL injury and eversion ankle sprain, as well as higher rates of knee injury in NCAA college turf games. There have been other studies that similarly, or that conversely show no significant difference in injury rates in collegiate women's soccer, as well as high school football. And then the big thing is there's a lot of conflict of interest in this topic. There are 3 studies that, of course, show there's an increased injury on natural grass, but these 3 studies have all been sponsored by the turf industry. So the purpose of this is to quantify and categorize the rates of lower extremity injuries in NFL players on turf versus natural grass. And we focused on lower extremity injuries given these biomechanical studies that propose this mechanism for increased injury. Secondarily, we wanted to characterize the degree of time missed due to these injuries to give us kind of a proxy of the severity, and then similarly, the proportion of these injuries that ultimately went on to surgery. So we pulled data from the 2021 and 2022 NFL seasons, looking at scouring through news reports of players that were injured and how much time they missed. For every injury recorded, we found the field type, the player position, age, weather that day, history of previous injury in that player, injury type, and then whether or not they went on to surgery. The outcomes we were able to pull, so we looked at injury incidence on grass versus turf. We looked at subsequent weeks missed because of this injury, and then the incidence of injury requiring subsequent surgery on grass versus turf. Using surgery as our outcome, we did a multivariable analysis to look at risk of injury requiring surgery, and these are the different factors that we pulled that we were able to control for. So in terms of results, in total there were 16 turf stadiums, 14 grass stadiums. Total injuries across those 2 years, about 718, and it's about even between those 2 years. We also broke that down by player position, and we grouped player position based on the kinds of activities that those players are expected to perform. So notably, most injured players were the secondaries, the cornerback or safety, and then secondarily would be the running back, fullback, tight end position. So this is the breakdown of kind of all the injury incidents over years, and then we used weeks missed as kind of a proxy to look at the distribution of severity of injury. I think it's a lot of numbers. So most importantly, if you look at the combined data, on grass, the incidence was about 1.22 injuries per game compared to turf, which is 1.42, meaning that for every game played, there was on average 1.22 lower extremity injuries on grass, 1.42 on turf. And then if you go all the way to the right, the incidence of injuries requiring subsequent surgery on grass was 0.18 compared to turf, which was 0.31. These are small numbers, but in the context of kind of the NFL, that's still an increase. And then if you look at the distribution across the kind of our proxy for severity, it looks pretty much equally distributed for both turf and grass. So the main focus we wanted to look at was surgery. So the most common surgeries that were performed after injury included Achilles tendon repair, ACL reconstruction, and then ankle or syndesmotic ORIF. On our bivariate model, we found that history of prior injury and field type were the only 2 factors that affected risk for requiring surgery. And then in the multivariate model, the odds ratio of surgery on turf, of an injury sustained on turf compared to grass was 1.6, and that was statistically significant. Other factors like weather, age, position, week of the injury occurring, meaning that if it occurred later in the season versus earlier, and then history of previous injury, none of those were statistically significant. So in conclusion, our big takeaways from the study is that there's a higher incidence of lower extremity injuries on turf compared to natural grass. The odds of injury leading to surgery were significantly higher on turf versus grass, and in particular, we found ACL injuries, Achilles injuries, and ankle injuries. Limitations, the big limitation of the study is that we had to use public records to collect the data, so there could be an underestimate of incidence, especially because not every small injury was reported, and because we were using public data of games, we weren't able to capture data from practice sessions or preseason, for example, that could also affect player decisions to stay or to not play subsequent games. We had an inability to account for game day surface conditions, so we knew the weather, but there are NFL measures that they kind of use to look at the ground condition based on the weather, which we weren't able to account for. And then obviously patient personal factors or team factors would also affect your decision to pursue surgery or to sit out of a game. So next steps, I think the study does a good job of looking at trends of injury on these two different surfaces and could help inform decisions on player safety, and then also potentially inform developments of new field turf materials to address this biomechanical issue, and then potential footwear during games. These are my references. Thank you.